Good morning, good afternoon, everyone. My name's Anthony Priori. I'm the digital marketing manager at TPGI. So we're going to give people 1 minute to sign in and then we'll get started briefly. I still see a couple people trickling in, so we're just going to give it 1 more minute and then we'll get started. Okay, thank you everyone for joining us today for our webinar, Understanding ADA Title II, Accessibility Auditing, Compliance, and Prioritization, with David Sloan, Chief Accessibility Officer and User Experience Practice Manager. Before we get started, I just have a few housekeeping items I'd like to get to. So firstly, this session is being recorded, and we're going to email everyone the recording after the event. Secondly, we have captions available, so feel free to turn those on and use them as needed. We will have time for a live Q&A later in the session, so please use the Q&A box and we'll answer as many of the questions as we can at the end of the presentation. I do want to emphasize the Q&A box is a little bit easier for us to find and keep track of everything. Sometimes if you send your questions to the chat, they can get lost. So if you do have a question, please be mindful of that, but we'll try do our best to monitor everything. And then lastly, if anyone needs any accessibility support, training, or usability testing, we will send out an email with a link to schedule a time to speak with one of our experts. So with that, I'm going to pass it off to David and let him provide an introduction for himself.
Thanks very much, Anthony, and welcome everyone to this webinar, another in our series looking at the ADA and the Title II rule that was published last year on digital accessibility. And in this webinar, we're going to look a little bit more closely about at the role of the accessibility audit in helping organizations covered under ADA Title II use the accessibility audit to help them with their strategy for meeting the requirements and maintaining compliance with those requirements over time. We'll also start with an overview of the ADA Title II digital accessibility rule, just to make sure we're all on the same page in terms of what organizations are covered, what they need to do, and when they need to do that by. So with that all said, let's dive in with a short prologue, which we always state at the start of any webinar that references legislation. This webinar does not offer legal advice. TPGI is a digital accessibility consultancy. We do not and cannot provide legal advice. And we recommend that you always seek guidance from a qualified legal professional if you're concerned about how the ADA or any other law applies to your particular organization and circumstance. Second, to say decisions made by the current administration in the US have created some uncertainty over the direction of disability rights legislation and regulation. And really, this webinar won't speculate on what may or may not happen in the future, including anything around the recent news that the Department of Justice may be re-examining some aspects of the ADA title rule, in particular its impact on public entities. We're really focusing on the current published rule as it's written, and how it can help public entities and people who work with those public entities make sure that the digital resources that they provide are accessible to and usable by people with disabilities. So let's move on to sort of get some common ground with an overview of the ADA Title II rule on digital accessibility. And first of all, let's remind ourselves what Title II of the ADA applies to. The original text of Title II of the ADA, as published in 1990, says that subject to the provisions of the subchapter, no qualified individual with a disability shall, by reasons of such disability, be excluded from participation in or be denied the benefits of the services, programs, or activities of a public entity or be subjected to discrimination by any such entity. And public entities covered by Title II mean any state or local government organization or organizations and agencies funded by state and local governments in the US. And that includes a whole range of different types of organization, including public schools, colleges, universities, hospitals and health clinics, public transportation agencies and locations for accessing public transport, public utilities, libraries, election facilities, police stations, courtrooms, detention facilities, a whole range of ways in which members of the public can receive programs, services, and activities that are funded through state and local government. Now, the Department of Justice has always maintained that Title II applies to services and programs provided through websites and mobile apps and other digital resources. And really, in 2024, the new rule that was published back in early last year really underlined that commitment, that intent, by intentionally placing accessibility requirements specifically on web content and mobile apps used by public entities to provide programs, services, and activities. And it really intended to add language to the existing ADA Title II regulation to provide more clarity to covered organizations and how they meet those ADA responsibilities of non-discrimination and effective communication when providing programs, services, and activities through digital resources that really didn't exist in any material form back when the ADA was introduced in 1990. So the rule really is intended to clarify how organizations that are covered by ADA Title II can meet their obligations when thinking about the digital landscape, whereas the ADA has always been very strong in terms of the physical landscape, the built environment, and how physical premises and other places where people can receive goods, facilities, and services, or say programs, services, and activities, may encounter those services. So one important part of the rule is it's not intended to reduce protection for people with disabilities where other applicable laws or regulations may provide a higher level of protection. It's a baseline set of requirements. So if you work for or work with a public entity where an applicable state law or local law with more stringent accessibility requirements applies, that would take precedence. The ADA Title II rule is not intended to weaken or reduce the level of accessibility that you would be expected to apply. So What technologies are covered by this new rule? Well, essentially web content and mobile apps. By web content, the rule specifically means HTML web pages, including embedded audio and video, and also digital documents, conventional digital documents such as Word, PowerPoint, PDF, that are made available through the web and are used to provide programs, services, and activities to the population the public entity serves. Now, it's important to underline that Title II doesn't specifically address employment, so it doesn't address applications only for internal use by public entities. That would be covered by Title I of the ADA. So it's not to say that a public entity doesn't need to bother making digital applications, web applications, and other applications used by its employees accessible. It's just that this rule applies specifically to those digital resources that are used to provide program services and activities to the population the entity serves. Now, there are some exceptions, which we'll talk about shortly. But first of all, let's consider the technical accessibility requirement. And the rule emphasizes that covered web content and mobile apps must meet a minimum of the Web Content Accessibility Guidelines, W3's WCAG version 2.1 to level AA standard. And while this is one version older than the latest version of WCAG, there's nothing in the rule that stops organizations adopting and meeting WCAG 2.2 level AA as a requirement. So that's setting a baseline, a minimum baseline, rather than a maximum level of conformance. And some people say, well, why didn't the rule adopt WCAG 2.2, or why didn't the rule adopt the latest version of WCAG, whatever that may be? In terms of the version referenced, the Department of Justice decided at the time the rule was published that WCAG 2.2 was still recent enough that not every organization would be familiar with its requirements or would have processes in place to achieve conformance with WCAG 2.2. So they chose the one version back. They were not able to issue a rule that refers to the latest version of a standard. They have to be very specific. A rule such as this has to be very specific in which version of a standard it references. So there was no option to reference the latest version, hence the situation we're in just now. I mean, it's helpful to note that at the moment, WCAG 2.1 AA aligns with current standards in the European Union, although that situation will change shortly when the updated version of EN 301549 is published, likely early in the new year. But for now, there's some harmonization between the US and the European Union, which is helpful for vendors and people who build digital products and sell them to public entities in the US and also to organizations operating in the EU. It also, WCAG 2.1 level AA does provide a higher level of protection or a higher benchmark than what's required for federal entities in the US, which are covered by the revised Section 508 ICT standards. So if you already supply to federal agencies and you're focused on meeting Section 508, then you have to go a little bit further. You have to go from WCAG 2.0 to 2.1 in order to provide digital products that that state and local government entities can use and meet their obligations. So a little bit of sort of realignment needed in terms of the US federal versus state and local government situation. In terms of deadlines for compliance, the deadlines are based on the population that the covered organization serves. So for state and local government entities that serve populations of 50,000 people or more, the deadline for compliance is April 24th, 2026. And for state and local government entities that serve a smaller population and for what are considered special district government entities, the deadline for compliance is a year later, in April 26, 2027. And when I was doing my math, I realized that's October 28th to April 24th next year. That's just under 6 months to go. So not a lot of time, but enough time to make some progress. And the Department of Justice set different deadlines based on the perceived capacity of a covered organization to meet the rules requirements and the likely effort that would be required based on quantity of content to address. So in essence, a smaller entity would likely have less resources to meet those requirements. So we're given more time. That was the logic behind the two different deadlines. I mentioned before there are some exceptions, and the existence of exceptions are really to help covered public entities prioritize their accessibility efforts on the highest impact areas, recognizing that many public entities may have large numbers of digital resources, some of which are rarely, if ever, used, legacy resources that still exist. The Department of Justice really wanted to help encourage public entities focus their efforts on where it mattered most, where it had most positive impact on people with disabilities. So while there are exceptions in the Title II web content and mobile app rule, these exceptions are specific to the rule and not to the ADA itself. So a public entity would still need to be ready to address accessibility to meet those ADA obligations to ensure effective communication and provide reasonable accommodations. It's just that the deadlines and the technical requirements don't apply to those exceptions. And the exceptions in general apply to certain types of content based on things such as its age, its format, its purpose, and who produced or provided it. The rule has these very specific definitions of content that's considered qualifying for an exception. If a piece of content doesn't meet that full definition, then the exception doesn't apply. So if you consider that a piece of digital content may be subject to the exception, read the rule and be sure that it fully meets all of the conditions for applying the exception. Otherwise, it doesn't apply. So what are these exceptions? Well, firstly, archived web content. Archived means, as defined in the rule, something that's kept in a clearly recognizable archived area, kept only for reference, research, or record keeping. And if a document changes, then it's no longer archived content, so it's subject to the rule. Similarly, pre-existing conventional electronic documents that are not currently used to provide programs, activities, or services are a listed exception. And again, pre-existing means it was already in existence when the applicable deadline occurred. But again, if it is updated, then it comes into play and the exception no longer applies. Thirdly, an exception is for content posted by a third party that wasn't engaged by a public entity to provide that content. So that's pretty much covers things like if a public entity had published a news item and there was an opportunity for people to comment on that or provide feedback or maybe post on a social media page, that's content that a third party provided that the public entity didn't specifically commission or contract that third party to provide. It's volunteered by that third party, and that content would not be covered by the rule. The fourth exception relates to individualized password protected content. And the final exception covers pre-existing social media content posted by the covered organization. So that's legacy content, tweets or Facebook posts or whatever that the covered organization, the public entity itself, published before the deadline. And they would not be expected to go back and address accessibility issues in that pre-existing social media content under the rule. Other potential exceptions exist. So in situations where not meeting or where we're trying to meet those technical accessibility requirements would cause undue burden and or require fundamental alteration. And these are two clauses that are present throughout the ADA, in that if meeting requirements would cost too much, given the public entity's budget or financial capability, or if meeting requirements would change the resource too much, would make it completely different or change its purpose beyond what it's intended to be provided for, then those exception situations would be met. Again, there's a very specific process to assess a situation to decide whether one of those exception criteria applies, and it's important to understand that process if a public entity thinks that there may be a situation to claim undue burden or fundamental alteration. Another potential exception would be when the existence of an accessibility barrier can be mitigated by providing a conforming alternative version instead of a single version of a digital resource that meets WCAG 2.1 level AA. This is likely to be a very rare situation, but maybe a solution for very specific situations where a technology can't be made fully accessible, but likely to be a pretty rare occurrence. And then the third exception is where not meeting technical accessibility requirements doesn't materially affect content, access to content functionality or participation for people with disabilities. In other words, where the nature and existence of an accessibility issue doesn't actually stop people from successfully using a digital resource. And the Title II rule is a very specific definition of what that means. That would be when a person with a disability can access the same information as people without disabilities, engage in the same interactions as people without disabilities, conduct the same transactions as people without disabilities, and otherwise participate in or benefit from the same programs, services, and activities as people without disabilities. So again, if it's a very specific situation, but potentially something that may apply in a particular digital resource. So with that background covered, let's now move on to think about a strategy for meeting the rule requirements. And when we think about ADA compliance strategy, it's helpful to recognize that the ADA, having been in effect since 1990, has a very established approach that public entities are obliged to follow in terms of understanding where they are and what to do to make sure that they bring their program services and activities into conformance. And that's focusing on understanding the current state, often referred to as a self-evaluation. And then secondly, taking action to address shortcomings in that current state, forming and implementing an action plan. And I've broken down that action plan into two kind of parallel activities. One is fixing the issues in your current digital resources, which is, we call that a corrective action plan, and then implementing a strategy for ensuring that new resources created from now on meet and maintain meeting those accessibility requirements. And we call that a plan for new content. And distinguishing these phases of work help break down the task of understanding where you are and making sure that you are doing what you can to meet those digital requirements in a very intentional way, following the process that's already existed for many years that cover the physical estate and landscape that a public entity may control and may use to provide programs, services, and activities. And if you work in a public entity, the chances are that you already have people in place. You may have an ADA coordinator, or more than one ADA coordinator. You may have processes and procedures in place You may already have conducted a self-evaluation that's kind of maybe more focused on your physical environment. Taking advantage of that work and figuring out how it was done can help you piggyback on that effort when you consider the current obligations to meet these digital accessibility requirements. So let's look more about the self-evaluation phase. And this is where we start thinking about one of the main focuses of this webinar, which is the role the accessibility audit can play in this work. And with self-evaluation, the best start is always with inventorying existing resources. You can't fix what you don't know exists. So finding out what digital resources that you have and which of them are subject to the ADA Title II rule helps you understand the scope and size of the work that lies ahead. So find out and document all of your web content and mobile apps that are covered under the ADA Title II rule. Think about the exception criteria when you're inventorying those digital resources. Some of them may not be covered under the Title II rule. Doesn't mean to say that they don't have any accessibility obligations, but it may help you when you decide when to assess them in order to figure out what changes might need to be made. So once you've documented or inventoried all the digital resources you have that would be subject to the rule, prioritize those resources in order of testing. So help figure out which do you need to look at first in terms of understanding where accessibility barriers may exist. And consider factors such as the purpose of the resource. What program, service, or activity does this digital resource support? Frequency and criticality of use. How often do people use it? Is this a resource that's used every day by thousands of people, or is it something that's less frequently covered? But even if it's less frequently used, is it something that provides a critical service? Maybe it's an emergency, a resource that supports dealing with emergency situations, natural, extreme weather or other situations that don't happen very often. But when they do, it's really critical that people can use this resource for its intended purpose. Prior planned lifetime is another factor that might influence when you evaluate and figure out what to do with accessibility of a digital resource. If you're intending to retire it or replace it with a new resource, maybe there's less pressure to evaluate it just now because you know you're going to be replacing it with a new resource. Obviously, it's important that its replacement will be accessible, but the pressure to evaluate something that's already going away maybe less of a priority than other resources. And then ownership. This may relate to whether the resource is owned in-house or whether it's provided by a third party. And third-party resources, you may have less control over the accessibility of those resources. We'll come back and talk about that a little bit more further on. But ownership is a significant factor in terms of prioritizing what to test, given that in this case, a third-party resource, you'll need to rely on that third party to address accessibility, or if they can't or won't, then that you'll have to figure out how you'll accommodate people affected by barriers in that resource. Then once you've inventoried your content and prioritized it, then you test that content. You test those existing resources to find out where accessibility barriers may be, to find out how well they conform with that technical level of accessibility defined in the rule, namely WCAG 2.1 level AA. So in that priority order, test or audit each resource for conformance with those requirements. And the best approach to take is to use a mix of testing methods, using automated tools to automatically scan resources and report against certain requirements of WCAG 2.1 AA. Then manual testing allows you to test a more complete set of requirements. Usability testing with people with disabilities is another technique that allows you to gather information, less so on technical conformance, but more on whether somebody can use a resource for its intended purpose. So depending on whether you have access to usability testing capabilities, or maybe you already have data from people with disabilities on issues with certain resources. All of this information can help you understand and build a picture of the current level of accessibility. And you may have other reports of issues that have already been reported, third-party reports of accessibility shortcomings of a resource. Wherever you can find that information, it's all valuable input to understanding where the barriers are in a current digital resource. So thinking more about automated testing as a strategy, accessibility platform tools are comprehensive and powerful pieces of software that can scan web pages, components, user flows, or whole websites against a subset of the success criteria of WCAG and report on WCAG failures and on issues of concern that require manual checks to verify whether this is genuinely an issue or maybe it isn't actually an issue. And using automated tools has many benefits. They're very quick to run. They can test lots of content at scale, so you get data for a large number of digital assets at a very very quickly. They help you gather data for benchmarking and performance over time. The more powerful tools can present data in a way that allows you to identify trends, changes in conformance over time. So there's lots of very helpful for benchmarking and measuring performance. Their limitation is that they don't test against all possible accessibility issues. Certainly tools are getting more powerful, and with the advent of AI, we can likely see more accessibility testing will be possible through automated means. But for now, certainly they can't be relied upon to test against all possible issues, and their results do require manual verification. But automated testing tools provide a really valuable part of that this process of self-evaluation of understanding current state. Then manual testing. Manual testing allows comprehensive testing against all of WCAG, and effectively is the basis of the auditing process. If we consider an audit to be a more formal process of manual and automated testing of a resource to find out to the extent to which it conforms with WCAG. And manual testing can certainly be speeded up with the use of tools for specific tests, so to help sort of reduce error and speed up the process. Combine testing, you can combine manual testing against those standards with compatibility testing using different browsers, different assistive technologies. So you can gather more information beyond testing against conformance to test whether a digital resource works as intended in different browsers and using different assistive technologies. There are clear benefits to manual testing in terms of fuller coverage of what you can test against. And the manual testing process naturally lends itself to generating remediation advice that's specific to the resource in question. So as you test, you can identify not only that a problem exists, but you can also compose guidance for the people who own the resource and are responsible for ensuring its accessibility, to give them advice that's appropriate to that resource, rather than more generic advice that may be difficult to apply to a particular situation. You can use manual methods where resources may have limited automation opportunities, and you can identify, based on those testing results, how do we help users affected by the barriers while they still exist? So manual testing also helps you consider an issue from a user's perspective. How would somebody get around this issue? A tool can't necessarily, an automated tool can't necessarily give you that level of insight. And as a public entity responsible for supporting people with disabilities, while those barriers remain, you need to be able to provide a means to allow affected people to still access those programs, services, and activities that may be impeded through the presence of a digital accessibility barrier. The limitations of manual testing are mainly in terms of the time taken to complete a manual test and the level of expertise that would be needed to ensure accuracy of results and consistency in reporting results over time. So there may, public entities may not always have that internal expertise and may need to rely on third parties to provide that manual testing service. But certainly in terms of comprehensiveness, in terms of understanding what the current state is in terms of conformance to technical standards, manual testing really is the gold standard. So then we move from understanding where we are into action planning. What do we do with what we've discovered about the current state? And that's just where the corrective action plan steps up. And we're focusing here on remediating existing resources, those resources that we tested to understand where the extent to which they met those technical requirements. We then need to move on to fix the barriers identified in testing. And again, it's really helpful to take a prioritized approach to remediation and consider factors such as the severity of a barrier on affected groups. Does the presence of this accessibility barrier mean that people are completely unable to perform a task? Or is it more a case that they're impeded slightly, but it's something that can be worked through with a little bit of effort, or there's an alternative way that's maybe more inefficient, but certainly possible? So severity on the affected groups is one prioritization factor. The effort to fix is another one. Is this a straightforward, easy fix, or is it something that's going to require more effort and maybe a level of expertise that is not easy to find within the public entity, and maybe something that you need to figure out how are we going to fix this, especially if it's provided by a third party. The effort to fix may be particularly challenging. And a third prioritization factor is the availability of workarounds for people who are affected by barriers. So it's kind of related to the severity, but if a barrier with high severity is present, but there is another way that doesn't use the digital resource in question that allows people to be accommodated, then maybe that slightly reduces the level of urgency to fixing the barrier, because there's another way that people can achieve the underlying program, service, or activity, or complete the task in question. And then once you have this prioritization, then it's a process of going through and fixing the barriers the best you can, get that resource towards that level of conformance required by the ADA Title II rule. And then it's important, once you've implemented those fixes, to validate those remediation efforts through further testing. And that could be through automated manual means, and especially including usability testing where you can with people with disabilities, so that those remediation efforts are verified not only to have met the standards requirements, but also provide a user experience that's acceptable and effective for people with disabilities. So thinking about remediation, in making those changes to code, making those changes to content, to visual design is important. It's also important to record and document your remediation efforts. And that really is to provide evidence of remediation to anyone who might need to know what you've done to address issues and move toward compliance. So for each resource, recording the methodology that you approached to test it for accessibility, and the approach you took to implement remediation. So those prioritization kind of characteristics that we talked about, both for deciding what to test and what to fix first once you've tested something, that documenting that and including that in your methodology helps you provide evidence that you went about this process of self-evaluation and corrective action in a very intentional, deliberate way. Then reporting on progress in remediation is an important thing to document, so you can tell anyone who needs to know what progress you've made in addressing barriers that may be present, making use of bug tracking systems to record accessibility defects and to record progress in fixing those is a great way to show progress in remediation. And very closely related to that is the support that you're providing for people affected by barriers that haven't yet been fixed. So what are you doing to provide assistance to people who are blocked or impeded from accessing a particular program, service, or activity, or a particular task using a digital resource where that resource is known to have barriers and those barriers are known not to be fixed? Providing that support, that accommodation for people affected is part of the documentation process and allows you to sort of, as you make further progress in remediation, that support can be reduced because it's not needed as you fix those barriers. And documentation is also essential if you are looking at those exemptions or exceptions that we discussed earlier and justifying a decision for non-remediation. You've found barriers or you know a resource may contain accessibility barriers, but you're not doing anything about it because you have decided that it meets one or more of the exception criteria identified in the Title II rule. Again, that's absolutely okay. That's what those exceptions are there for, but still documenting the decisions in line with the ADA's process for doing so, and also being ready to realize, well, this resource may contain barriers. So if somebody with a disability wants to use it for a particular purpose, then we still have to be ready to do something about that if and when the time comes. And the best start is to document the current situation. So we've talked about the process of corrective action based on a self-assessment or self-evaluation. Let's now sort of pivot into thinking about planning for new content. And this is where we kind of transition to taking advantage of this self-evaluation to build a strategy for planning and implementing, creating new digital content that meets accessibility requirements and meets that over time so that this is all done in a sustainable way and it's not kind of one burst of activity that then is impossible to sustain. And one of the really important ways we can do this is to really make full advantage of what we learned from an audit. Now, audits can sometimes get a bit of a bad reputation in the accessibility field. And really, when this really sort of stems from organizations whose accessibility strategy is one that is audit a website and then fix it best we can, but don't make any changes to how we build things in the future. So every time it's the same cycle over and over again, and over time an audit on its own becomes just an exercise in repetition and no progress is made. But audits are a really rich source of information, obviously, as we've seen, to help you identify barriers that need to be fixed and how to fix them, but also in providing valuable insight into how you can strengthen the processes that exist to create digital resources for the future. So once you have an audit for a digital resource, you can look at the data that the audit identified and analyze that to discover things like the patterns of issues reported in the audit. Where did the issues occur? What were the characteristics? Are there patterns emerging in that as there's a particular issue appears in multiple locations? Maybe it's in the way, any page that's got a form, the same kind of issues around labeling might appear, or there's issues that reoccur that are related to the sort of page layout. Anything where you can see a recurrence in an issue or particular patterns gives you an indication that there's something systemic going on, and maybe there's a solution that can be applied once and fix everywhere. Related to that, use that analysis to discover the root cause of the issue as best you can. what caused the accessibility issue reported in the audit to appear. And then, once you've identified that root cause, how could the issue be prevented from reoccurring in the future? We think about it, audits as giving remediation advice, but they're also an opportunity to improve processes, practices, change how things are done, so that in future the chances of issues occurring are reduced. And this is all great input in the plan for new content in terms of building that organizational strategy to help ensure that accessibility is more effectively integrated into overall strategy for managing digital content and making decisions on creating or using digital content for better service delivery. So thinking about a little bit more in terms of acting strategically on audit results, really our goal here is to use that audit data on the accessibility barriers to identify process improvements. And the analysis results could identify a number of different ways where improvements could be made. For example, they could give you evidence that there's some opportunity for training to help improve knowledge and skills amongst people involved in creating digital content, whether they are using a content management system to write text and upload graphics. It's more of a focus on content creation, or maybe it's developer training, or maybe it's designer training, or maybe it's training around a particular format like PDF, for example. The analysis can help you pinpoint where more accessibility training would help build greater awareness and focusing that training on issues that you've observed recurring through the results of, or analyzing the results of audits. Fixing reusable components where you've discovered through audits that there's an issue that occurs on every page and it's always in the same place, and it turns out that it's a reusable component which people use on multiple websites and applications. Providing that fix in one place ensures that fix is percolated across multiple pages and screens wherever that component is reused. Maybe there's an opportunity for improved documentation. Maybe your organization provides access to developers to use user interface components in different ways in different websites, or maybe there's guidance on visual design, but it doesn't really address what you need to do to preserve the accessibility features that are already provided in those designs or in those components. So maybe the goal is to improve the documentation to help people use those resources in the best way, and not to sort of use them in a way that sort of takes away the accessibility value that was already built into them. Maybe the analysis helps you pinpoint areas where you're using third-party content, and that third-party content has accessibility barriers. So maybe this is a longer-term sort of conversation in terms of how might you replace that third-party content that has accessibility barriers with an alternative that performs more effectively in terms of accessibility. Or maybe the audit data identifies situations where you could make different decisions based on improving the user experience for people with disabilities, where selecting a different, adjusting the design or changing the user interface component could improve usability and enhance user experience for people with disabilities. And that leads you then to think about how could we better involve people with disabilities in digital strategy in terms of understanding how are we going to use digital resources to help provide better programs, services, and activities? How do we make sure that we make the right design decisions that benefit accessibility? And how do we verify that those decisions were correct when we implement them in functional code? So just as a kind of worked example, here's an example, a fictitious audit issue. This is a kind of slide is showing a sort of summary categories of what an organization might receive when they have an audit done on a website. In this case, the issue is that the address lookup button is not focusable or operable using the keyboard. The location is the sign up form in a sign up for parking permit page. So this is an example of a form where you might enter part of your address and then an option is available to select your address from a menu. And this would save time, cut down on errors. But the audit found a problem with this functionality. And the impact in this particular situation is that people who use the keyboard or other input devices, don't use a mouse, can't activate that button to select their address from a list, and then end up having to manually enter their address. And for people with physical disabilities, that extra manual effort has additional impact on top, compared to a population more generally. The severity is rated as high, in that while it's not impossible for somebody to enter an address, it is a significant impact. It makes it much more inefficient, requires much more effort to complete a task that the feature that's provided should make more efficient. The corresponding success criterion WCAG is 2.1.1, relating to keyboard operability. And the remediation advice in this example: use a button element in place of the current div element. Make sure that scripts controlling the button functionality respond to keystrokes, enter and spacebar. So make sure that button is operable using the keyboard. So that's great. We've got an audit issue that tells us where it is, what impact the issue has, and some remediation advice. But we can then also think about more strategically, how did this issue occur? And what can we do to stop it occurring again? Was this just one developer writing a line of code once that made a mistake? Or is it a component that is somewhere that is reusable? Is there somewhere else that we can go to change how that button element is coded, and improve that the quality, the accessibility of that code, so that anytime it's used in the future, it's not we don't have this accessibility issue reoccurring. So that helps us figure out, well, who's in charge of that? If it is a reusable component, who's in charge of that? How can we help them improve the code and improve the documentation on using that code of that reusable component in a way that reduces the chances of this accessibility barrier occurring again. And one really helpful resource when you're thinking about an accessibility issue that corresponds to a particular success criterion is to look at W3C's draft accessibility roles responsibilities matrix, the ARRM. This is a resource that takes every success criteria of WCAG and applies a level of responsibility based on a particular role that someone might have in a product team. So the slide I'm showing just now is an excerpt from a table from the matrix, where the first column is each WCAG success criteria, and then the subsequent columns are key roles in a digital products development: business analyst, content authoring, visual design, user experience design, and front-end development. And for each success criteria, it assigns a level of responsibility, where that might be primary responsibility, secondary responsibility, a contributor. So it gives you a reference to say, well, who would be responsible for handling issues relating to this success criteria? And it helps you distribute that responsibility, and helps you figure out how might we manage this more effectively. So just as we move towards the end of this webinar, I want to briefly mention other key components of a sustainable accessibility strategy. I hope that the audit is now seen as something that's more than just a list of what's wrong and a set of instructions for how to remediate those issues, but also a key to unlocking a way to evolve strategy to make accessibility something that's more sustainable over time. But there are other aspects of organizational accessibility strategy, such as ensuring leadership support is present, that accessibility is identified as an organizational priority, that an accessibility policy is in place to communicate that accessibility is a core value of an organization, and how it's going to commit to that value, how it supports everyone responsible, for meeting that policy. A governance framework that communicates how accessibility efforts will be monitored and what happens when something's found not to meet the policy or does not meet the technical accessibility requirements the organization must meet. Definitions of accessibility responsibility for every role. Recruitment and staff development plans that prioritize accessibility skills so that as people join the organization and have a role in its digital landscape, that accessibility is a valued skill, and as people develop their skills and move up through the hierarchy of the organization, that accessibility skills development is rewarded. And then that vendor management policy that we've alluded to before, having those conversations, having those policies and procedures in place that manage accessibility risk when you select and use third-party technologies. Really almost worth a webinar in its own right, how you can effectively work with vendors. But the more you can communicate your expectations, and also when you and when you assess candidate solutions and understand the level of accessibility risk that you take on, if you select one of those solutions, then the more you can manage that risk and minimize the chances that people are going to encounter accessibility barriers. So I'm just going to finish up with referencing a couple of resources, and everyone on this webinar will have access to the slides. The official text of the final rule is published in the Federal Register, and that's a place to read the details of the rule, including valuable commentary from the Department of Justice on how they responded to public feedback on the first draft of the rule and justification for why the rule is as it is. There are some other great resources, including a fact sheet on the rule from the Department of Justice, and a small entity compliance guide specifically targeted at those smaller public entities. So all of these supporting resources are available on the ada.gov website. Again, the links are on the slides, and you'll all have access to those after the webinar. And another shout out for the ADA Coordinator Training Program, www.adacoordinator.org. This is a formal training program that anyone who wants to learn more about the ADA and how it can be implemented in Title II entities. There's a structured educational program and a qualification at the end of that, and I highly recommend you can check that out as well. And just finishing up, TPGI can help you with your ADA efforts. Check out our website and our services, and as Anthony said, please let us know if there's anything we can do to help out with you, with your understanding of what you need to do, and prioritizing efforts to meet those requirements. So with a couple of minutes left, I'm going to jump to looking at the questions. Anthony, I opened up the Q&A box, so I'll just go through them quickly. What can we do when a vendor does not meet the standard 2.1 AA and our university wants to utilize it still? Good question. So I think a lot of it depends on whether you have a contractual agreement with that vendor that they should provide you with a solution that meets WCAG 2.1 AA. If you don't, then you have less leverage to force them to make improvements. And then you need to consider, well, what's the lifetime of the contract? Again, I am not a lawyer, so I'm certainly not a contract lawyer, but looking at that relationship with the vendor, is there any way that you can use your contractual relationship with them to put pressure on them to improve accessibility of the solution they've provided you with? Bear in mind that if they are also supplying other public schools and universities or any other public entity, then all of those other clients have the same requirements. So this is not just a one-off. You are asking for accessibility improvements. Every one of their customers in state and local government sector will have the same requirements. So sort of emphasizing that this is good for their business is definitely one way to go. But until they make changes, then you have to understand what those barriers look like and how you can support people affected by those barriers. For organizations that provide a service to various state and local government entities, what would the deadline be, the earlier date? That's a good question. If the organization is a private entity, then it's not subject to the ADA Title II requirement. So then it would be a case of, well, what deadline are your public entities subject to, and then you need to obviously take efforts to reassure them that you are taking steps to help them. If your organization that provides a service is itself a public entity, then there is guidance on the ADA website in terms of calculating what's the size of the population and therefore which deadline would apply to you. Question, what does the process look like to determine if materials are considered an exception to the rule? I don't know if there's a formal process. I mean, I think certainly looking at the rule and how it defines those exceptions and going into as much detail as possible, and then taking that information and adopting it as an internal process would be the best way to go. The ADA, the Title II rule, doesn't define a process, but it defines the exceptions. So if your organizational process adopts those exceptions, then you can then be guided in figuring out, does this or does this not apply? And at this point, I know we're slightly over time. So I think, Anthony, what we might do is just answer the rest by email. Do you think that would work?
Yeah, that's totally fine. I have them all documented. I see there's at least 4 in here. So yes, what we'll do is in the follow-up email that you'll receive with the slide deck and the recording, I'll also include a document with the Dave's answers to the questions.
Sounds good. Thank you all for sticking around. I know we've gone slightly over time, but it's always a good sign when there are lots of questions and we don't have time to answer them all. So thank you everyone for your engagement and attendance today. We'll be in touch with more answers to the questions, and you find me on LinkedIn if you want to continue the conversation. Thank you again for your attendance, and best of luck with your ADA efforts and your accessibility efforts. Thank you.
Thanks, everyone. Bye now.